Good morning. Welcome to the Board of Nursing Board meeting. Today is day 2. Today is May 19th, and we will take roll call to establish a quorum. My name is Dolores Trujillo. I am a practicing RN, and I was appointed by Governor Newsom in the direct care provider role. I am also the current president of the board. Vice President Mary Fagan.
Good morning, everyone. I'm Mary Fagan. I was appointed by Governor Newsom in the Nursing Services Administrator role.
Thank you, Mary. Elizabeth Woods.
Good morning, Elizabeth Woods, and I've been on the board a while, and I was appointed by Governor Brown in the advanced practice role.
Thank you. Jovita Dominguez.
Good morning. My name is Jovita Dominguez, and I am in the education role, practicing nurse.
Thank you. And Tricia Wynn.
Hi, good morning, everyone. I'm Tricia Wynn. I was appointed by Governor Newsom in the public member role.
Thank you. Our quorum has been established. We will pick up where we left off yesterday, and that is item 9.0. Just to draw your attention to the agenda, there is no item 9.1.2, 9.1.1, I'm sorry. So we'll start with 9.0, and Shannon Johnson will give our report.
Okay, can everybody hear me now?
No.
Yes? Okay, I see Lori shaking her head. Yes, okay, great.
I can hear you.
Good morning, everybody. I am Shannon Johnson, and I am the enforcement chief for the board. And I will be presenting agenda item 9.1, which is an update of the Enforcement Intervention and Investigations units. We will start with the hiring of our 2 deputy chiefs. So I'm pleased to announce that we have been able to fill both of the deputy chief positions in enforcement. The first was Jaspreet Pabla. She accepted the deputy chief position overseeing complaint intake and intervention. Her first day was April 19th. She was previously the probation manager in BRN's probation unit. The other position was filled by Tim Bunger. He accepted the position overseeing discipline and probation. His first day was April 12th, and he previously held the position as discipline manager in BRN's enforcement division. We're currently recruiting to backfill those 2 positions because now we do have 2 staff service manager 1 positions available. Investigations, let me see. Investigations completed their first round of interviews for their supervising special investigator 1 in the central region. Second interviews are being held mid-May. We have a goal to have that position filled July 1st. BRN, we continue to try to recruit qualified registered nurses for our expert practice consultants. We do have vacancies in long-term care, skilled nursing, acute rehabilitation, hospice, home health, our OP ambulatory clinic, and cosmetic Botox laser. So those are the areas that we really need. Of course, we need them in all areas, but those areas are in a much higher need than others. The information, if you want to become an expert practice consultant, is located on this agenda item. There is information and an application on our website. So if you'd like to visit our website and apply or see what the criteria would be to become an expert, you can find it there. The investigations unit worked with the Attorney General's office and with our staff, and they created training guide. So investigating BRN cases training guide. Based on the results from the recently conducted survey to the investigators, updates were made to that guide. The training was held last week on May 12th and was very successful. We're still working with DFI and continuing to follow the pilot program that was initiated back in September 2019. We updated it and it is continued through at this point to December 2022. And we'll be reviewing again for the extension of that. And then we've also included the stats for discipline, probation, intervention. One thing I do want to point out in intervention is our vacancies that we have currently. We have quite a few. If you'll notice under that, there's 14 vacancies in Sacramento, the Bay Area, Los Angeles, Irvine, Fresno, Palm Springs, San Jose, Ontario, the North Coast, the Northern California region, and then in Santa Ana. And these are public members, physicians, and registered nurse members. Again, the website is attached here to this agenda item summary. If anyone is interested in being an intervention evaluation committee member, you can find all the information on our website under the intervention tab. There is also Table D, which is all of the statistical information as of April 25th, as well as below that, the graphs in Table D. And then in Table E is the performance measures that get reported every month. And those are through March right now. So we've included February and March since the last meeting. Are there any questions on this agenda item summary?
Shannon, what's the impact of having so many vacancies on the evaluation committee members?
Well, right now what we're looking at, the impact would be if, just like with the board, if we don't have all the attendees at some of the meetings, we may not have a quorum possibly, which would result in having to cancel the meeting, not being able to vote on any items. We're looking at, because the numbers have decreased quite a bit in intervention, we're looking at the possibility of shuttering one or two of those committees, with our meetings being, the participants can actually attend those meetings virtually now. So the need to have them in a specific location for an IEC is not as important as it used to be prior to COVID and the teleworking situation. So we're looking at the possibility of maybe shuttering some of those IECs that have very low participant levels and that we have vacancies, so we can accommodate that. One thing I want to avoid is, for instance, if we have a participant who is getting close to being completed and they need to go before the IEC to complete their program, I don't want to prolong that for those participants. So we're trying to accommodate them and move them to other IECs right now. But that is what we are looking at, is shuttering some of those.
Thank you.
Welcome. Any other questions? If not, I'm going to move on to the next agenda item, which is agenda item 9.2. This is the possible action regarding appointments of intervention evaluation committee members.
Quick, Shannon, before you move on,
Yes.
do we have to go to public comment for the?
Oh, I'm sorry. Yes, you are absolutely
only?
correct.
Before we move on, thank you. So
We will be opening for public comment now. Sorry?
Thanks, Mark. Yes, we can open for public comment.
Thank you.
Sorry, thank you. We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comment. Would you like me to close this window?
Yes, Mark, thank you.
I'm sorry. Are there any public requests for comment there in person?
No, there is not.
All right. And are there any public requests for comment in San Diego?
None in San Diego.
Thank you. Okay, now can we close this window?
Yes, thank you.
Thank you.
Okay, so moving on to agenda item 9.2. This is the discussion and possible action regarding the appointment or reappointment of the Intervention Evaluation Committee members. And today we have 4. We have Martinez, who is a nurse member out of Fairfield. This is a reappointment, and all 4 today are reappointments. Diane Alvey, another nurse member in Los Angeles, IEC 3. Grace Murphy, nurse member in Los Angeles, IEC 3. And then we have Diane Souza, public member in San Diego, IEC 10. Again, these are all 4 reappointments. Their term expiration, if voted to reappoint, would be June 30, 2026. And so I'd like to call for a motion.
I'll make a motion to accept these individuals.
I second that. Can we open for public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Are there any public requests for comments there in HQ2?
No, there are no requests for comment. Thank
Okay. Are there any public requests for comments in San Diego?
No, they're not.
Thank you. Are we okay to close this window?
Yes, thank you.
Thank you.
Okay, we'll take it to a vote. I, Dolores Trujillo, votes yes. Vice President Mary Fagan,
Mary Fagan, yes.
Elizabeth Woods,
Woods, yes.
Jovita Dominguez,
Jovita, yes.
and Patricia Nguyen.
Win, yes.
Thank you. Motion carries.
Okay, unless there's any other questions for me, that concludes the intervention evaluation, or excuse me, the enforcement intervention committee.
Thank you, Shannon. I would also like to thank those who have been reappointed for their continued service. Moving on to Agendum 10.0. This is the report of the Legislative Committee. I am the chair, Dolores Trujillo, for the Legislative Committee. Lori? Is Loretta Melby on?
Hey, I'm on. Sorry about that. I have a lot of technical difficulties here right now.
Oh, okay.
My
Thank you.
computer just shut down, so I'm on my phone, so I'm actually not even able to access
Okay.
the ledge info at this particular moment. So
All
if you
right.
can give me 1 second, or if we have anybody at headquarters that can assist, that would be awesome. I am restarting my computer. I'm so sorry. It decided to restart during Shannon's update. And so I'm waiting for it to restart. I'm actually going to try to get on a different computer. The issue is that here with Dr. Mary Fagan, she does not have access to the Sacramento files in the G drive. So I have to use my computer to access the G drive to get to the information to be able to present. So my computer is restarting and hopefully it will be up and running soon. I apologize for the delay.
Okay, we'll use this period to take a 5-minute break.
Thank you so much. I will let you know when I'm up and running. I'm entering my password and such right now, and hopefully I can get connected again.
We'll come back at 9:27. Thank you.
Board President Dolores Trujillo, we can start. I don't know that it's going to get better at this point, so we will just move forward, and you and I will go through the ledge info. I don't want to delay this any further.
Before we start, I would like to welcome our new Chief of Legislation, Marissa Clark. We're happy that she's on board with us, and I personally cannot wait to work with her. So thank you, Marissa. All right. We're going to start with the direct impact bills. And
Yes.
Lori, should we just take position? There's a couple that we need to take positions on as a board.
There are ones that had been amended. We had previously taken a position on AB 852 it was in regards to nurse practitioners. This is and still is kind of the cleanup bill that went to AB 890 for the path to independent practice for the nurse practitioners. The regulatory package we passed yesterday, actually. To move forward. So originally it was just had some basic cleanup language in the bill. It kind of addressed some of the issues that weren't addressed previously. We were looking for fee authority for 103 certification, et cetera. It then changed. There was a big update to the bill where it became focused a lot on the Cures Act and became more of a pharmacy focused bill.
Yeah, I see that.
So it did change kind of the approach, but it does still have a lot of the cleanup information in it from AB 852, so AB 890, sorry. So today's laws amended has changed. It is now healthcare practitioners' electronic prescriptions, nurse practitioner scope of practice, and practice without standardized procedures. So it does go through a lot of that information. Most of it is talking about electronic submission of prescriptions and not a lot on the nurse practitioner updates. So that is in your meeting materials. You can go through and read that. We can, it was a position of support previously. And with this update, we can continue with a position of support or anything that the board may choose to do.
I would like to make a motion to continue our position of support. Do I have a second?
Yes, Woods, will second.
Great. Should we vote now, or do you want to vote at the end? Now? Okay. So Dolores Trujillo votes yes. Vice President Mary Fagan?
Do we need to take it to public comment?
Excuse me?
I'm sorry, do we have to take it to public comment?
Yes, I think what we
Yes,
can do is take it
thank
to public
you.
comment at the end, if you want to, since this is one
Okay.
agenda item to discuss all the bills, but we could take a position if you want to, and then we can move through if that seems to be a little bit easier.
I thought we would take our positions and then open it up for public comment. This is what we've done in the past, Mary.
Okay. All right, I vote yes.
So if you're going to vote one by one, I think it would be better to allow public comment on each,
Okay.
just so that the public can comment before you formally take your position. And I think that may be why in the past we have identified positions before and then taken one public comment session that would apply to all of the bills to kind of cut down on the number of public comment sessions through the legislative report. Either way works, but if you're going to do it one by one, just allow for the public comment on each.
We do need to vote one by one. So,
I realize
okay.
to hear
We
public
can
comment
do-
before I vote.
Okay, no problem. So, BRN moderator, can you please open it up for public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Are there any public requests for comments in HQ2?
There are no requests for comments here.
Thank you. Are there any public requests for comments in San Diego?
None in San Diego.
Thank you. There are no public requests for comment. Would you like me to close this window?
Yes, thank you. All right, we can take it
We want
to
to
a
move
vote
to
now.
AB 61662, or are we going to take a vote?
Let's take a vote.
Okay, cool.
All right. So Dolores Trujillo votes yes. Vice President Mary Fagan?
Mary Fagan, yes.
Elizabeth Woods?
Woods, yes.
Jovita Dominguez?
Jovita, yes.
And Patricia Nguyen?
Win, yes.
Thank you. Moving on to the next bill. It is AB 1662. This is sponsored by
Dolores.
Gibson.
So
Lori?
AB 1662, the board's position previously was a position of opposed. This is a bill that allows for people to reach out and contact the board and give them some information on what their background history was and ask the board if we think that they could still be licensed. It was amended. Previous to the amendment, it was done through just an email with the person letting us know, and then we would make a decision based on that. The change that amended now is that we could actually receive fingerprints for this to occur, so we can make a better decision based on the fingerprint results that come back. This was a position opposed. It does have a great fiscal impact. It also did not take into consideration the did not take into consideration the information that the applicant or potential applicant would provide. And so we weren't able to ensure that the information was accurate. We can get information on fingerprints. However, typically when we work with within our enforcement unit and we do evaluations, they pull records, not just the information that's received on fingerprints. So once you get information back on fingerprints, then you go to request or subpoena the records to be able to look at them, because it's different if you have a DUI versus if you have a DUI with your children in the back of your car and you got in a car accident. And so there's different levels of that information. So that's something that our enforcement unit raised as issues with implementing this. We also looked at it from a licensing perspective versus an education perspective. What happens in California with the pre-licensure nursing programs is the students that enroll in the program have to have a background check before they go out to complete their clinical rotations. When they go to complete their clinical rotations, the background check, that clearance that they get, is sent with the other information that is required to go to that healthcare facility in order to clear them to come in and take care of patients. They have to be cleared at the same level that the employees are at that institution, as to ensure patient safety, community safety, etc. So even though we could at the board level say, yes, we've looked at the fingerprint results, it looks to us that when you apply for application for licensure, when you graduate from school, we could potentially license you. That does not circumvent the process that the applicant needs to go through to get through nursing school, to get into the clinical sections, to be able to complete their program and graduate so that they're qualified for licensure. So what could happen, we believe, as an unintended consequence, is we could say, yes, by looking at this, you could be licensed. We could license them with a provisional license, et cetera. And that could be in conflict with what occurs at the school level. Clinical sites may have more stringent requirements than the state board, and they may not allow for people to participate in clinicals at that location, and that might be the only clinical rotation that the school has the ability to obtain for that entire cohort of students. So even though we may be able to say, yes, you might be licensed, they still may not be able to enter into school or complete school. So this is where the thought came out that potentially the pre-applicant would take this information and bring it back to the school and say, well, the board said they'd license me, why can't I get to clinicals? And then we would have to really work on that aspect. So those are some of the issues that we're seeing on implementation of this from a day-to-day work process. And that was the main things of consideration that we wanted to bring up so that you were aware, along with what, of course, is also written in our agenda board materials under number 6, AB 1662 Gibson's.
Thank you, Lori. Any comments or questions from the board? Patricia?
So I'm wondering if we have engaged in conversation with the author's office and, you know, what they're trying to accomplish that can't be accomplished right now under the existing procedures.
So currently there are no existing procedures to do a pre-application check. They contact the board on a pretty regular basis with us, and we do not do a pre-application review. We always say, you know, when you complete your education, you apply for a licensure, we will evaluate for you for licensure at that time. So there is not a comparable path for them to do currently. This is a DCA-wide bill. It doesn't just affect the BRN. So the BRN has not reached out individually to speak to the author. We are giving our feedback and both our areas of concern as well as our areas of support related to this bill through DCA, and DCA is doing the reach out. We are not doing that process.
Thank you. That is helpful.
Any other questions or comments from the board?
Lori, do we have anything on our website that would give some guidance around this to potential applicants?
We do. It's not necessarily clear, as most items on our website are not. We're working really hard to get that updated. When you go to our website, on the top, there's a search place, and you could type in disciplinary guidelines. You could type in enforcement. You can go to the enforcement tab where it talks about, it has the applicant enforcement webinar on there. And you can get a lot of information. There's FAQs, that webinar is actually key. A lot of our nursing students will go in there and watch that repeatedly. It is also linked to our director's handbook for our deans and directors to use as well. So there is information there. Our disciplinary guidelines are there that we utilize. And so that information is there, but it's not necessarily cut and dry. You cannot type in, you know, I have a DUI, can I get licensed? Because again, with the example I used previously, it's not just that you have a DUI, it's do you have multiple DUIs? Did you have your children in the car with you? Did you get in an accident why this occurred? There are many, many things, the length of time from your last DUI, et cetera, that come into play when doing an evaluation.
Mary, additionally, in the board materials, I believe if you click onto the bill, it links you to the actual bill and text.
Thank you.
So there are no additional questions or comments here. Are there any additional comments or questions from your end, Mary?
None here.
Okay. So I would like to make a motion to continue to oppose this bill. We oppose now. Do I have a second?
Jovita seconds.
Thank you. BRN moderator, can you please open it up for public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, I would like to make a comment. Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Board President Trujillo, there are no public requests for comments on the WebEx. Are there any public requests for comments in HQ2?
There are no other requests for comment.
Thank you. Are there any public requests for comments in San Diego?
Nope.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. Thank you. So we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan,
Mary Fagan, yes.
Elizabeth Woods,
Woods, a question. We're voting yes to continue our opposition, correct?
thank you. Jovita Dominguez,
Jovita votes yes.
Patricia Nguyen.
Nguyen, yes.
Okay, the motion carries. Moving on to the next bill, AB 1711. This has not been previously presented to the board. Lori, do you have information on this bill?
I do. AB 177 has not been previously presented to the board. It is
I think
not
it's AB 1711.
Sorry, 1711.
Uh,
It is not a BRN specific bill. It is, it does affect DCA wide. And it requires an agency to post a notice on the agency's internet website when a person or business operating system on behalf of the agency is required to issue a security breach notification. So because we do have a computerized license lookup, all of the data is done computerized, we do have personal information in there. And so if there were to be a breach, we would be responsible for notifying the persons or people that it affected. And so this just has further information on how that would happen. And what this one here specifically, the amendment specifically talks to is putting it onto our website, providing a link of the notice on the homepage or the first significant page. We do have a homepage, so we can do that. Put it in, it has larger type than the surrounding text, contrasting type color. We do have alerts on our website all the time. It's usually in red banners. It usually is right on the top, and we would probably follow it through doing that same process. This is something that the board can implement fairly easily, and I haven't ran into any unintended consequences that have been shared that I would need to share out to you guys today.
All right, thank you, Lori. Are there any questions or comments from the board? Any questions or comments in San Diego?
Nope.
Okay. So I would like to make a motion to watch this bill. Do I have a second?
I'll
Jovita
second this,
second.
Mary.
Can we open it up for public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests on the comment. I'm sorry, there are no public requests for comments on the WebEx. Would you like me to, I'm sorry, are there any public requests for comments in HQ2?
There are no requests for comment here.
All right, are there any public requests for comments in San Diego?
None in San Diego.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. All right, we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan,
Mary Fagan, yes.
Elizabeth Woods,
Woods, yes.
Jovita Dominguez,
Jovita, yes.
and Patricia Nguyen.
Nguyen, yes.
All right, motion carries.
This is Reza. I wanted to, just if we could go back to 1662 that was discussed just before the last bill. That's the one about the pre-qualification. So the board voted to take an opposed position. And this is, I guess, for the board and or Lori. With that, I don't know if we previously submitted a letter of opposition or whether with this vote we would do that. Is that part of the opposed position?
So the position letter has been sent. We had a previous opposed position.
Okay, so with us not changing the position, we wouldn't need to send a new letter, is that?
We could send a new letter, because it does have different information that we're addressing. There were amendments, so we could address the amendments as well, just to kind of let them know that we're still needing more in order for this to be implementable well.
The reason I bring it up is if we are going to send a new letter, maybe the board wants to decide whether to send a new letter, and if so, whether you have enough to write that letter and convey what the board's opposition is.
Yes, it would be great to get that discussion from our board members, because what we do when we do send oppose or letters of support is our board staff listens to the board member discussion in any areas of concern or support that the board members raise. Specifically, we do make an attempt to enter that into the letter so that the author's office knows exactly what the concerns are of our board.
So with AB 1662, the problem that they seem to be trying to solve with that, I think, is pretty obvious, but it's presumably to allow people who are interested in nursing to avoid the time and expense of going to nursing school if they're ultimately going to be denied for licensure.
Yes.
So with that in mind, what areas of again, Lori, do you feel like you have enough, or do you want board members to provide specific critiques of the bill and areas that may you want to bring to the author's attention that could lead to a different position if they were to be addressed?
So I know previously we had drafted the opposition letter, letting them know about the impact that this was, that we weren't able to get adequate information for the board to make a decision on licensure. They did make changes by adding the fingerprint requirement and putting a fee attached to it, which did help. But some of the continued issues is just not being able to get records. That is what we base our decision on, is the actual court records, the arrest records, et cetera, in order to get the entire picture. The majority of applicants are licensed once we're able to get the entire picture, because a lot of times what is just basically reported, you can read into, you can create your own story. So when we get the actual facts, it's able to provide a better picture. We're able to evaluate that, follow our disciplinary guidelines, and make a decision to license. That license, however, may be a provisional license where there is some monitoring and such that they have to manage through, but they are able to get licensed once we're able to review the entirety of the infraction or the issue that occurred.
Do you have any more questions, Risa?
Yep. Lori, one of the things that I'm concerned about, and this might not actually be the case, but with just the amount of work that our enforcement team already has, and, you know, looking at the length of time it takes to deal with the enforcement issues that we have, and not because this isn't just a BRN. When you look at the table that Shannon presented with the number of days it's taking to deal with cases. Would that also take time from the same team who's working these cases to be making recommendations or taking positions on pre-application requests?
So yes and no, and I'll explain that answer, is it would absolutely take staff time within enforcement. When we did give the fiscal impact, we included the number of positions as well as support staff, supervisory staff that would be needed to do that work. And we would have to have additional positions in order to complete this process. The other kind of unknown for us at this point is the number of inquiries that we would get where people would reach out to say, can you look at my stuff so that I know if I can be licensed? We did pull the UCSF data where they let us know how many people have applied to nursing school, and it was, I believe, 55,000. And so we could potentially get up to 55,000 increase each year into this. And so that needed to be taken into consideration. You know, we did not use 55,000 as the actual number because we know that not everybody, when you look at greater population, there's only a small percentage that have any criminal history that would need to be evaluated. So taking that into consideration, we did do a fiscal impact. We did let them know positions that we would need in order to accommodate this, and that information was sent forward.
Was there any other?
I have a quick comment.
Patricia Nguyen?
Thank you very much. The one thing that I'm, concerned about on this bill is that it applies to every single board in the state. So if it was the Board of Registered Nursing, I'd be very concerned about really detailing every single issue. But because this is like every single board, then I kind of feel like, the Department of Consumer Affairs should really be looking at it rather than each board individually. So I feel less inclined to want to give a, point-by-point analysis since it's so much broader than just our board.
It is, and what we've been doing is, because it does affect DCA wide, is we have been giving them the feedback on how it affects our individual board, and I'm sure that they are taking that feedback into consideration and including it in any position that they may take. We did, however, send out a position of opposed letter previously, and we did kind of detail some of our concerns just so that the author was aware of it.
Do we know the position that other boards have taken?
Most, the initial review did take a position of oppose. It was a bill that had a lot of areas, gray areas, a lot of areas that weren't fleshed out completely. And so there wasn't really any clear guidance on how each board would be able to implement it in the way that it was written. With these new amendments, it is getting more clear, but I don't think that we're there yet. We do know that most bills have to make it through committee by the end of June, so we do expect some additional edits to come through. And if they do, we did talk yesterday about noticing a additional board meeting in June for June 23rd to follow the committee meetings or to occur on the same day as the committee meetings. And so if there were any additional changes, that would then make it where it was easier to implement, something that the board can do without any unintended consequences. I could present that information at that point, and we could change our position prior to it going to committee.
This is Reza. From the information available at Ledge Info, at this moment, it looks like so far 2 boards have gone on record opposing, and that's the Dental Hygiene Board and the Board for Professional Engineers, Land Surveyors, and Geologists. And if you're interested, I can talk about why. The other thing I wanted to just say is that so far I've not really heard any new areas of concern about the bill. And the amendment that seems to have been made from the last version to this version is that previously pre-qualification applicants can send whatever information they want to the board and ask for this determination, and the board would have to make a decision based on what they send us. Whereas now with the new amendment, the board can request fingerprints and have a lot more concrete information to base a decision on. That doesn't seem, to me at least, to be a bad thing, that amendment, if this bill were to go forward. So I don't necessarily see new areas of concern for a new opposition letter.
Correct. I agree with you, Reza. The addition of the fingerprints, and then they did add, I believe, a fee that we can charge for that. And those were both positive moves towards being able to implement it. The biggest area of concern was just how it is carried out in reality. And that was us looking at it from a board perspective for licensing prior to the person enrolling into school, which again is still very different from what happens when a person does enroll in school and needs to have an additional clearance or a separate clearance to go through clinical sites. And so our decision may not necessarily match up with a school's decision or a clinical facility's decision. And so even though we may be able to tell them, yes, if you make it to us, you could potentially be licensed, the unintended consequence that really needs to be brought out is that that doesn't guarantee them a slot within school. And if they are able to get into school, it doesn't guarantee that they would be able to complete and progress through school, because they may not be able to complete the clinical component that is required for hands-on.
Okay, I just brought it up. I just wanted to be, for staff to be clear after the discussion of whether to send an opposition letter and what content it should have. So if, Lori, if you're good, if the rest of the board is good, then I think we're good.
I think we are good. I did want to make one other statement that currently what we do within our enforcement is, because they live scan or turn in their fingerprints and it's through DOJ, anytime that we get an arrest record that occurs, we get that information sent directly to us. So another area that we brought up as an area of concern was that if they were in school 1 year, 2 years, 3 years, 4 years, whatever it ended up being, that additional infractions or additional times could occur when they break a law. And we would not have that information as well. And so again, when they came to get licensed, if they did get through school, they may not get the same response, because now they would have additional areas that we would have to review and address. And so it is a different setup than what our routine process is within our enforcement department. Other than that, though, I am okay with our position of oppose. I think I have enough information to be able to add in there if we did decide to do an additional letter. But yeah, I don't have any other questions. I think we should be able to move forward.
The last thing I'll say is I do find it interesting, the other boards that I mentioned that took an opposed position, in addition to the workload and cost effect, the Professional Engineers, Land Surveyors, and Geologists Board said that it's important to make it clear that any pre-application determination is non-binding and could change to the applicant's detriment or benefit over time. The Dental Hygiene Board, I think, raised kind of a similar issue where they said if an additional conviction were to occur prior to licensing, it is possible the pre-approval would be rescinded and licensure denied depending on vetting the new conviction. So kind of along the lines of what you were saying, Lori.
That's good information. Thank you, Reza.
Mm-hmm.
All right. Moving on to number 4, AB 2626.
Okay, AB 2626 is a medical board. It also affects physician assistants and our nursing board. And it makes it where the board cannot revoke a license or discipline solely on the provider carrying out or performing an abortion. And so that is medical doctors, physician's assistants, and nurse practitioners. I did not see, oh, I do see nurse midwife, sorry, and nurse midwives. So that is where this bill is at. It does have an urgency clause. And so if it does pass with a majority passing, then it should go into effect immediately. But it basically says that the board shall not suspend or revoke the certification or license of a nurse practitioner, nurse midwife as well, solely for performing an abortion, so long as the holder performs an abortion in accordance with the provisions of this chapter and the Reproductive Privacy Act.
So I
And
don't
we have not
see that we,
previously taken a position on this one.
excuse me? Lori, I didn't hear what you last said.
We have not previously taken a position on
call.
this one.
Okay. And it looks like the bill was already amended before being presented to our board. Was amended on 4/18 through the legislature. Are there any questions or comments from the board members?
What was the amendment?
I'd have to look it up.
I can look at the history. Let me pull that up really quick. Again, I apologize because I am kind of
Yeah,
flying
I'm trying
blind
to pull
on
it up
this
too.
because
My
of
computer is
technical
working.
issues. Excuse me.
Sorry, Lori, if you have it, my computer is
I don't.
working.
I'm not seeing anything substantial that was the amended other than what we're reporting out here. It's just that it's medical doctors, physician's assistants, nurse midwives, and nurse practitioners. It's just asking the board or telling the board that they cannot revoke a license or a certification based solely on the fact that they performed or assisted in an abortion. I'm not seeing anything other than that that is of any substance that needs to be addressed at this point in that bill analysis.
Any questions or comments from the board?
I think we should support it.
Patricia Nguyen?
Yeah, thank you very much. You know, I'm inclined to support a bill like this also, but I wonder if there's any history of a board ever revoking a license based on something like this. I mean, I'm wondering if this is just a kind of a political policy statement, and I support that statement, but I'm just wondering if, this is kind of a bill in search of a problem.
I could speak to the Board of Registered Nursing. We have in the past allowed for nurse practitioners and nurse midwives under their scope of practice to perform and assist in abortions, as well as RNs are able to assist in the abortion process as well. And I don't know that we would do any discipline on that because that is within their scope of practice. If they did something during that case that did violate their scope of practice or caused harm through either negligence or just a breach of some sort of their role, then we would discipline based on that, based on, if they weren't able to do the normal process and an injury occurred, or they gave an incorrect medication, or they didn't follow up and identify signs and symptoms of any kind of increased health risk or some sort of thing that would come up, then we would evaluate that on an individual basis. But it would not, and it would not even in the past have been something where we would discipline just because they performed or assisted in the performance of it, because it is currently in our statutory scope of practice that nurse practitioners, nurse midwives can perform and RNs can assist.
Thank you, Lori. We also have a comment from Marissa Clark.
Hello, good morning. Sorry, this is Marissa Clark, the new Chief of Legislative Affairs. I just want to answer the question around the most recent amend. It was actually adding that urgency clause. It was amended, I believe, on Monday. Before it wasn't previously in there, and it says the urgency is necessary due to the draft opinion from the Supreme Court and the fact that several states around the nation are poised to allow professional boards to take disciplinary action. Therefore, it's necessary for this to take effect immediately should it be signed. So that was the most recent change. Thank you.
Thank you. Thank you, Marissa. All right, any other questions or comments from the board?
I'm just going to let you know, Dolores, that Marissa has now proved to me that she is competent to take over this role, and she will be doing this at the next Ledge Committee and the next board. So, Marissa, tag, you're it.
That. All right. So I would like to, well, are there any questions or comments from San Diego?
Nope, none here.
None? So there was a motion made by Elizabeth Woods. I would like to second that motion to support this bill. BRN moderator, can we open it?
Clarify, so Betty's motion is to support and Dolores is
second.
seconding. Okay, thank you.
Can we open it up for public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comment on the WebEx. Are there any public requests for comments in HQ2?
There are no further requests for comment here.
Thank you. Are there any public requests for comments in San Diego?
None in San Diego.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. Thank you. So we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan.
Mary Fagan, yes.
Elizabeth Woods.
Woods, yes.
Jovita Dominguez.
Jovita, yes.
And Patricia Nguyen.
Nguyen, yes.
Thank you. Moving on to the next bill. This is AB 2684. This has
Okay,
not been presented to the board. Lori?
This 2684 had been presented to the board. This is our sunrise or sunset bill. There was no substance in it prior, and now it has been amended and there is some substance into it. And so I will go ahead and cover some of the areas that are in the bill right now, reminding the board members that this is not a final bill. This will continue to go through amendments, and it is set for hearing on June 27th. And so any additional amendments that do occur to this bill prior to the 23rd board meeting, we will share at the 23rd board meeting and see what position our board would like to continue to take. The one amendment is based on stakeholder feedback. The legislative staff added that there is created within the jurisdiction of the board a nursing education advisory committee, which shall solicit input from approved nursing programs to study and recommend nursing education standards to the board. That in itself is not a necessarily negative thing. However, when reaching out and speaking with the legislative staff, I did share that in 2002, the board did have a nursing education advisory committee. That nursing education advisory committee served from 2002 to 2015. What occurred in 2015 is we went in front of our sunset hearing, and the legislative staff recommended that we combine the Nursing Education Advisory Committee with the Nursing Workforce Advisory Committee, therefore creating NEWAC, one of the advisory committees that we actually voted on and passed a charter on yesterday. In 2015, we did combine them. The feedback was that education and workforce have a lot of overlap and a lot of similar issues that they need to face and work on together. We agreed with that in 2015, and we did go ahead and form the NEWAC committee. That NEWAC committee, when it was formed, did have a membership of 27 to 29 people. It was very difficult to get quorum. And from 2015 forward, they worked a lot on the 50% in simulation and looking at various requirements for academic preparation, and also worked with really kind of securing workforce pipeline and making sure that our people in California have enough healthcare workers to assist. And so as we've seen throughout the last year, there's been a robust discussions in most of our committee meetings talking about provider deficits, not having enough providers, not having enough nurses, not having enough nursing schools, et cetera. And so the feedback that we gave them was, although this is, something that they are reaching out, that I think we can do that with workforce. So the legislative staff is reviewing that. They took that information back to stakeholders, and they will give us a final decision on whether or not they're going to add workforce into this advisory committee and put the NEWAC committee into statute. Right now, it is a creation of a new advisory committee. We have 4 advisory committees as we stand right now. This would be a 5th if it doesn't change and add the NEWAC into statute. And we would just manage it as we would manage any other advisory committee. It would have an increased workload. Therefore, it would have an impact. It would go ahead and have greater stakeholder involvement. So that's a good thing as well. And so that's one of the areas that were amended. The other areas that were amended were where the executive officer shall develop a uniform method for evaluating requests and granting approvals pursuant to this section. That section is education approval. We do have a uniform method for approving new programs, and we do have a uniform method for continuing approval of programs that are already originally approved. So it does want that information to be shared with the nursing education consultants. It has already, and they want us to post this approved method and any revisions on the board's website. That is easy to implement as those uniform methods are already there. The uniform method for initial granting of approval is already on our website, so that is complete. We would have to add the continuing approval process, and that could be added to our website. But we are already mostly in compliance with that section. Another remaining update is talking about a uniform method. I probably scrolled over to, sorry. One of the other amendments that I could talk about right now, because that is what's up on my screen, is the payment for clinical agencies. In our last board meeting, we discussed this in regards to a Rubio bill. That Rubio bill did not advance forward. And the board took a straight oppose to the entirety of that bill. And so what occurred is they took some information from that bill and moved it into this bill. We kind of had an inkling that that would occur, is that that bill that was introduced by Rubio in 2019 was supported by a lot of the private for-profit and private not-for-profit post-secondary education schools. And that bill in 2019 did not advance forward. That same bill was reintroduced now in this legislative session with very minimal amendments, if any, and our board again opposed it. But there are some information that they're wanting to bring over from that bill and put into our sunset bill, which this is where it gets slightly concerning, because our board took a full position of oppose on that last one. So this information that did come through, it says an institution of higher education or a private post-secondary school of nursing subject to section 2786 shall not make a payment to any clinical agency or facility in exchange for clinical experience placements for students enrolled in a nursing program offered by or affiliated with institution of private post-secondary school of nursing. A payment shall be deemed a violation of subdivision A if made within 2 years of the clinical experience placement at a facility. The payment of pass-through fees for purpose of credentialing, data bank registration, or symbol fees are not considered a violation of the subdivision. When I reached out to the author's office on this to speak with the legislative staff, I let them know that the board had been looking at this for quite a few years. They are in support of pursuing that, but the language that is incorporated here needed some additional work. I did share with them a copy of a contract that a school had provided to me, where they do within that contract pay a set amount of money for each student to be at that clinical facility. And that does cover the PPE. It covers the additional printer paper and computers and ink, et cetera, that is utilized when those students are there. And that's not necessarily considered a payment to get into a clinical agency. And so we would need to flush that out so that we're not penalizing legitimate contracts that have a need behind it. And that is for those smaller community-based agencies to be able to support clinical experiences of students without negatively affecting their bottom line and or putting them out of business or causing them to go through some sort of a hardship. The intention around this section is to stop some of those backdoor deals that do occur. There have been reports that people will make large donations to a fund at the hospital, and then that school that is tied to that large donation for a fund then gets more clinical placements. There have been reports where, you know, they serve on a different planning committee or a board together, and they say, hey, you know, this can, I'd love to get my students in there, and they said, we'd love to have you, and they handshake, and then they work on something of mutual agreement to get something passed. And so these deals that are not forthright is really where the board wanted to focus in years past when this was originally brought up in 2019. The other thing that occurs is institutions will give tuition discounts, large tuition discounts to hospital sites that they partner with, where they say, if we can do clinicals at your hospital setting, we will educate your LVNs or your CNAs so that they can become an RN, and we will give them free tuition, or we will make them only pay, you know, a portion of the tuition And this allows for continued enrollment and continued enrollment growth. And those are very difficult for us to differentiate, for us to be able to look at and say, are they on the up and up? Are they truly displacing other students? What is the impact of that? And so the way that this section is written currently does not flush all that out. And so I am in conversations with the legislative staff to see what we can do to kind of clarify this language so that it can adequately address the areas of concern that has been brought forth to our board in the previous years and continue to be brought forward to our board. It's not there yet, but I think they're moving in the right direction for that. And so that is really where we're at. One of the other things that this bill does is it extends the provisions that were under AB 2288, where the school is allowed to have the 50% in SIM, again, information that we addressed yesterday, in updating permanently with updating the regulation. And so those current provisions that passed with AB 2288 were to extend to the first academic year. That passed. Our sunset bill extended it one additional year to this year. And now this bill going forward will extend it one more academic year, where that will then expire. Those emergency provisions will expire at the end of next year's academic year, so in June of 2023. And those are the amendments currently. We always like to support our sunset bill because, you know, it's an inherent that we want to continue as a board. But there are some areas that are not necessarily ready and complete in order to take a full position of support at this point. So we're just asking for you guys to discuss, give me any concerns, any areas that you are in agreement with, so that we can take a position. And just remembering that our current position prior to the amendments was a position of support.
Thank you, Lori. It sounds like there's still areas that need to be worked on with this bill. I'd be willing to look at a support if amended, rather than watch, to upgrade it to support if amended. That's my comment on this. Are there any other comments?
I have a question about this. What does this first paragraph have to do with the rest of this? And I don't understand the first paragraph either. That the governor's power to remove any member of the board that was appointed by the governor. How's that play?
Yes, and so I'll explain that, Betty. That was actually how the bill was introduced. It was a placeholder bill. There was no substance to our sunset or sunrise at that point. And you'll notice we still do not have a date in this. So we are still set to sunset in January. So the placeholder bill, when it was introduced, talks about changing the authority of the governor to remove board members. And previously, the governor had the ability to remove any of the 9 members of our board, including the 2 that he or she did not have the ability, did not appoint. So the change in the bill, when it was a placeholder bill that had already been brought forward in front of our board, which is when we took our previous position, and thank you, Dolores, for catching that, that was a watch position, not a support, was that the governor could only remove the board members that the governor appoints. And therefore, the Senate and Assembly appointments would have to be removed by their appointing authority and not the governor.
What is this other non-substantive changes? What's all that?
I'm not sure I'm understanding the question, Betty. I apologize.
I don't understand so the governor could still, without cause, remove members that the governor appointed without cause. They could just be removed. Is that my understanding of it? Okay. And it says, as well as other non-substantive changes. What's that mean?
The other non-substantive changes were where they were making some basic changes to the text. And so I'll go through here where it says, for this purpose of this chapter, it had board in quotes or the board in quotes refers to. And so they've lined that out and now says, for the purpose of this chapter, board means the Board of Registered Nursing. So they removed the second part where it says or the board. Then they added some basic text changes where they added, I'm trying to find it. I'm sorry, that was really like the big one, which really had no effect on it. Those were the non-substantial changes. There are some times where you can look down in section 3 of 2708A, E, where it crosses out the word statute, comma, and then just says statute without a comma. And so those are some of the non-substantive changes. And so they're not anything at that point. That
They're
would be
not
an issue.
changes that change the meaning of the text.
Yeah, and those were there prior to this last amendment. Those were there when the board reviewed this last time and took a position of support. So it's position of watch, I apologize. And so what I did at that point is when it comes back in front of our board, we only talk about the amendments from the last time that it was here, which is why I didn't cover that, but I'm happy to cover that now. And then I am getting notice that Marissa at headquarters there may have some additional information. And so I would love to pass the mic to her.
No, I think you actually covered it perfectly. I was just going to also follow up that normally non-substantive changes are just wordsmithing, grammar. The Legislative Council is the Office of Lawyers that drafts these. So anytime there's changes, they go in and make kind of minor adjustments. But Lori captured it beautifully.
Thank you, Marissa. Patricia Nguyen?
Well, I would love to see this board take a strong support position of the provisions that we like, and then suggest strongly that provisions that really won't work for us be amended out. In other words, the sections that were put in from another bill that we had opposed for very good reason, that we suggest that be removed. So a strong support if amended.
We are, as Lori stated, we are still in discussion with the author's office. Correct me if I'm wrong, Lori?
We are, and a position of support with amendments is perfect for me to bring that forward and continue those discussions. If we took a position of support as it is, then I would not have the ability, because I represent the board, to talk about the other areas that are still concerning because we have supported them. So by taking a position of support with amendments, I am able to continue those conversations and continue to work with the legislative staff to get this bill to be better implementable and have the desired effect that they're looking for and that our board has been asking for.
Thank you, Lori. Any other questions or comments from the board or HQ audience? All right. Any other questions or comments from San Diego?
No?
Okay. So regarding this bill, I would like to make a motion to change from watch to support if amended. Do I have a second?
I'll second. Nguyen seconds.
Thank you. BRN moderator, can we open it up for public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and will move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Are there any public requests for comments there in HQ2?
There are no further requests for comment.
Thank you. Are there any public requests for comments in San Diego?
No comments here.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. Thank you. All right, we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan.
Mary Fagan, yes.
Elizabeth Woods.
Woods, yes.
Jovita Dominguez.
Jovita, yes.
Patricia Nguyen.
Nguyen, yes.
Motion carries. All right. Moving on to indirect impact bills. The first one is AB 2055, which
So
was
AB
amended.
Yes, thank you. AB 2055 is a Cures Data Bank bill. The reason that it's indirect is, of course, it's not within our Nursing Practice Act. The reason that we're talking about it is because the Cures database is something that our providers that have prescriptive authority utilize. And so that is why it's brought to this board meeting for discussion. Previously, the Cures system was being moved to a department specified by the governor. What it is currently now is that department has been designated, and they will move the Cures data bank that was originally housed within the Department of Justice to the Department of Pharmacy. That is essentially the only change that occurred. And so we would like to get the board's position on this, to move the Cures data bank from the Department of Justice to the Department of Pharmacy, or Board of Pharmacy. I apologize.
Sounds appropriate to me. Any questions or comments from the board?
Or was the Department of Justice a state department, or was it federal?
It was within California.
In California still, okay. And I would
This is
support.
Tricia Nguyen. I'm just wondering what the, problem has been at the Department of Justice, and why it should be moving. I'm not unfamiliar with I used to work at the Department of Justice, so I know we had the Cures database there, and I'm just wondering what the, problem is.
I don't know that there was necessarily a problem. I know that it had grown quite large, and there is a lot of overlap with Cures with Pharmacy Board. And so I think that the decision to move it to Pharmacy Board is absolutely appropriate. That is what has been discussed within DCA. The Pharmacy Board is in support of it as well, to come to them. And I think it just more aligns versus having any kind of a problem. I think it kind of thwarts off any problems that could occur. And so it aligns with the board that manages this stuff versus having it in a separate institution, essentially.
Thank you. That's helpful.
This is Reza. I can add to that. The bill analysis says currently Cures remains housed under the DOJ because it evolved from early tools established primarily for law enforcement investigations. However, experts and policymakers now recognize that combating prescription drug abuse should be approached through a health-oriented lens rather than through criminal prosecutions. 49 states have PDMPs like Cures. However, California is only one of 4 states that houses their PDMP in a law enforcement agency. While the Attorney General has worked laudably to advance the state's progress against the opioid abuse crisis, Cures would be better positioned in a more health-focused department.
Yeah, so no issues yet, but ensuring that this is better handled and no issues come in the future. It definitely is a position that makes sense.
Any other questions or comments from the board? Any other questions or comments in San Diego?
Nope.
Okay. I would like to make a motion to continue to watch this bill.
Jovita seconds.
Can we,
I guess I have a question, is what do you want to watch for? What's the issue with it that prevents you from wanting to support it?
well, actually, right now, it's housed, I don't think the bill, Lori, will the bill go through any other changes or amendments?
I haven't seen any. There's always a possibility. I think a position of support as it's written right now is appropriate.
Okay, I withdraw my former motion, and I would like to make a motion to support.
Jovita seconds that.
Okay, can we open it up for public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Are there any public requests for comments in HQ2?
There are no further requests for comments here.
Thank you. Are there any public requests for comments in San Diego?
No requests here.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. All right, we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan,
Mary Fagan, yes.
Elizabeth Woods,
Woods, yes.
Jovita Dominguez,
Jovita, yes.
and Patricia Nguyen.
Win, yes.
Thank you. Okay. Moving on to the next bill. This is AB 2790. Reporting of crimes mandated reporters. Lori?
I have 2107 next. Is that not correct?
Oh. 107. Yes.
I have
Sorry.
2107. And I think that this was just for clarification. 2107 is a Department of Consumer Affairs bill. And previously it was specifically written to allow for nasal swabbing for COVID. And I believe we took a position of support. However, it was amended, I believe, the day that we were at the board meeting when we took the position of support, and it expanded that. And so it wasn't just primarily for COVID testing. And so what this does now is it changes it to, I'll read the section, for a rapid antigen or point of care polymerase chain reaction pathogen test classified as waived under Clia. An adult who has received appropriate training and is acting under the direction of the laboratory director and ordering physician may do both of the following: collect the anterior nasal swabs if a person to be tested is unable to self-swab, and perform the test on the collected sample. So I know that there was discussion for support of this because it was COVID specific. We also had a discussion around the person licensed under this chapter in the molecular biology. I know Reza had asked a question on that one. Those remain the same. So the only thing that was highlighted here that we wanted to ensure that the board was aware is that it was changed from just, the COVID testing to any rapid antigen point of care polymerase chain reaction pathogen test collected. So this could be an example that you'd be familiar with. Both Dr. Fagan and Dolores would be, and the nurses on the team is a RSV swab. So that would be a nasal swab. Typically those are in children. And so the person would not be able to self-swab. And so this would allow a person, an adult who has received the appropriate training and acting under the direction of the laboratory director and ordered physician may perform that additional swab and any additional swabs similar to that. Does remain that it is an anterior nasal swab, and that did not change, but it does open it up from being specific to COVID. It could be for other reasons.
Do we know what position other boards have taken?
Sorry, I do not. Again, I apologize. I'm kind of running blind right here. Reza, are you able to pull up anything that maybe other boards have taken additional positions?
I'm looking at the bill analysis. It looks like, I'm doing this on the fly. I don't see any DCA boards. It says California Association for Medical Laboratory Technology as opposed to the bill, and explains why, but does not identify any DCA boards.
Why are they opposed to the bill?
It's kind of lengthy. I'll start to read it here. Current amendments to Business and Professions Code 1207 do not expand the CGMB scientist scope of practice to include the performance of molecular tests for infectious agents of disease, but in fact would expand their scope of practice to direct a microbiology laboratory. CGMB scientists are not qualified to direct clinical microbiology laboratories. CAMLT proposes that amendments to BPC 1210 be made instead that would allow CGMB scientists to perform molecular tests for infectious agents of disease, but not allow for directorship of clinical microbiology laboratories. CAMLT opposes all amendments to BPC 1206.5. According to the Assembly Bill Analysis dated March 31st, 2022, Public Health Institute argues that parents of school children unable to self-swab are prohibited from collecting and performing tests on their own children. That is simply not true. Under BPC 1241b7, any individual is authorized to perform clinical laboratory tests or examinations approved by the Federal Food and Drug Administration for sale to the public without a prescription in the form of an over-the-counter test kit on their own bodies or on their minor children or legal wards. Furthermore, and then it continues. You want me to read the next couple paragraphs? Furthermore, CA lab law does not permit licensed or unlicensed clinical lab personnel to collect any patient sample with the exception of collection of human blood. The authority to collect nasal swabs from others unable to self-collect is contained within the nursing and physician scope of practice. CLIA waiver director and ordering physician do not have the authority in California to delegate training of laypersons or to authorize specimen collection activity through California lab law. Therefore, any amendment to current law to allow for the collection of nasal swabs by lay persons should be placed in the nursing or physician scope of practice. Renumbering BPC 1206.5 may have unintended consequences. other BPC sections may refer to the current numbering scheme and may be nullified as a result. For the reasons mentioned above, CAMLT must oppose this bill unless amended to restore all of BPC 1206.5 and 1207, and appropriate amendments are made to BPC 1210.
I think we may want to watch this bill instead of support it right now.
Yeah, I'm agreeing with you, Mary. All right, any other questions or comments from the board? I would like to make a motion to change the board's position based on this amended thus far text from support to watch. Do I have a second?
I'll second, Woods.
Thank you, Elizabeth. Can we open it up for public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment."
This is Reza. Real quick while we wait, I just wanted to also mention what I read was in the bill analysis, the arguments in opposition. There are a couple of entities that wrote in support. Just wanted to put that out there. Sorry? Okay, I'll repeat that. So I just wanted to be clear that beside the arguments in opposition that I just read, there were a couple of entities that wrote in support that are identified in the bill analysis. So if you are interested in having that read as well, let me know. Otherwise, if you're
being that this is an indirect bill, I'm fine. So, are we still open for public comment?
Yes, I was waiting for him to finish. There are no public requests for comments on the WebEx. Are there any public requests for comments there in HQ2?
No requests for comments here.
Thank you. Are there any public requests for comments in San Diego?
None here.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. All right, so we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan.
Mary Fagan, yes.
Elizabeth Woods.
Woods, yes.
Jovita Dominguez.
Jovita, yes.
Patricia Wynn.
Wynn, yes.
All right, motion carries. Moving on to now AB 2790. Lori?
Thank you. AB 2790 is reporting of crimes and mandated reporters. This bill changes or sets forth to change the mandated reporting requirement for healthcare regarding medical treatment. What they're saying with this now is that it would not be mandated for the healthcare provider to report the incident to law enforcement, but would instead have them set them up with a counseling support process. So there is sections at the top of the bill that talk about, it says, recognizing that abuse survivors often need to access healthcare and medical treatment apart from police reporting and criminal legal involvement. It replaces the mandated police reporting by medical professionals with offering connection to survivor services. Current law has that the healthcare professionals report to law enforcement when treating patients for domestic violence related injury, and they state, the author states, that that has had a chilling effect of preventing survivors from seeking medical care, decreasing patient autonomy and trust, and resulting in health providers being reluctant to address domestic violence with their patients. The author also states that national research confirms that medical mandatory reporting of adult domestic and sexual violence increases patient danger and insecurity, where he's being able to openly discuss abuse without the fear of police reporting produces a greater health and safety outcome. And so they're asking for mandatory reporting laws for adult domestic violence to focus on healthcare provider compliance and liability rather than on providing survivor-centered support. And so it changes what we currently do. So as a healthcare provider now, someone presents with injury from a domestic violence, it is reported to law enforcement, and law enforcement steps in. And this would allow for the healthcare provider to not report it to law enforcement, but instead connect them with survivor services such as counseling, etc. There are positions of opposition that are noted in the bill analysis that Reza's been going to. Thank you, Reza, for that. One of them is from a position of oppose from SCIAFN, and that's a Southern California chapter of International Association of Forensic Nurses. Their position states here that the proposed repeal of mandatory reporting of domestic violence and sexual assault under California law, the way that the bill is currently written, will not help save lives. If this bill is passed as written, it may endanger victims and lead to increased incidents of violence and adverse outcomes, to include death. Any law that affects this vulnerable patient population must be carefully weighed and measured. It says domestic violence patients do not experience a single incident of violence. When they leave our hospitals, clinical, and medical centers, they are still in danger, potentially imminent lethal danger. Simply providing the patient a referral to an advocacy agency, an agency they have to initiate contact with and follow through with, is not enough. Victims do not report to law enforcement on their own for a variety of reasons, and when healthcare workers make a report to the law enforcement, it opens the door for them, takes the burden of making that decision off of the victim. And if a victim chooses not to participate with law enforcement, they can always decline their services, but a door has been opened, the opportunity offered, and the encounter documented. Repealing mandatory reporting laws must not be made lightly. If a law is to be repealed or modified, it must only be after extensive discussion between multidisciplinary partners and after current and relevant research has been reviewed and analyzed. This law has not measured up. So again, remember that this is an indirect bill, as it doesn't change our Nurse Practice Act, but it does directly affect the nursing providers, nurse practitioners, midwives, etc., that come under this provision of mandatory reporting. And so it would change the practice of our licensees.
I think we should oppose this bill. I think it puts patients at risk.
This has to do with health care. If you get the person out of the house, the victim may not get killed. I strongly oppose this bill.
Patricia Nguyen?
Yeah, I feel the same way. I think women's groups worked really hard in the 80s to get these mandatory reports in place to protect victims. And I have not kept up on the conversation, but this seems like we're going in the wrong direction.
Absolutely.
All right, any other questions or comments? Any other questions or comments from San Diego? From your end, Mary?
No, I'd like to make a motion that we oppose this bill.
I will second. BRN moderator, can you open it up for public comment, please?
We will will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform me that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Are there any public requests for comments in HQ2?
There are no further requests for comment here.
Thank you. Are there any public requests for comments in San Diego?
None here.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. All right, we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan.
Mary Fagan, yes.
Elizabeth Woods.
Yes to oppose it.
Jovita Dominguez.
Jovita, yes.
And Patricia Nguyen.
Win, yes.
Okay, motion carries. Moving on to SB 962. Lori?
Thank you. SB 962 is talking about clinical laboratory technology and moderate complexity laboratories. And so today's bill, it adds, sorry, I just lost my point here. So it changes the laboratory director designation to include an individual who meets the College of American Pathologists guidelines. It authorizes that individual who meets the College of American Pathologists guidelines to operate as a technical consultant in a moderate complexity lab. With respect to the above specified exceptions concerning a laboratory director for a clinical laboratory of an acute care hospital, the bill would expand those exceptions as specified. So there's federal law that typically happens with laboratories, and the states can make individual laws onto that. In one of the previous bills we talked about the Clia Waivers. There are many things that go through Clia Waivers that they sit there and they review, looking at complexity and whether or not those have to be performed in a laboratory setting or can be performed at the bedside. A common lab that's done at the bedside is under Clia waiver is the glucose monitoring, so the blood sugar testing. That is a very common one and that people can kind of identify with. And so that's really where this is focused. It's not changing any of those. The existing law federally has that. And then if you look at SB 962, they're saying that you have to hold a master's degree in chemical, physical, biological, or clinical laboratory science within 1 year of experience or performing, hold a bachelor's degree. The director of laboratory performing moderate complexity test may work as a technical consultant. The laboratory may be eligible to receive a certificate or of waiver if the laboratory only performs examinations and procedures which are approved for home use by FDA and employees methodologies which pose little risk to harms to patients and are simple to perform. And so the existing law already defines clinical laboratory. It defines multiple things and has specifications that the laboratory director is responsible for the overall operations. And it defines currently that the laboratory director is a person that has a duly licensed physician or surgeon. And so that's where the change does. It opens it up. You can also be a duly licensed clinical laboratory scientist, a duly licensed clinical laboratory a naturopathic doctor, an optometrist. So it talks about the licensing of these clinical laboratories, and what this bill does is expands that, saying that the clinical laboratory director has to hold the, can be a doctor of medicine as well, and changes their requirements.
Thank you, Lori. Any questions or comments from the board?
What positions have been taken on this from other organizations or boards?
I pulled up the bill summaries, and there was no oppose or support positions that I was able to locate.
There are, maybe you looked at a different one. The one I'm looking at identifies arguments in support from California Society for Respiratory Care and the Association of California Healthcare Districts and the Respiratory Care Board.
Thank you, Reza. You're better at this than I am.
There were a couple on there. Probably we were looking at different ones. So if you'd like, I can.
Yeah, that would be great. I'm willing to take any assistance you want to give me with this, as I still do not have access to my computer.
Would you like me to read from them?
I mean, I would love to hear from the laboratory what their perspective is. But it sounds like they haven't.
Doesn't sound like there's a position.
Yeah. I wonder if we wanted to just take a position of watch.
That I'm inclined to do that. You want to make a motion?
Yeah, I make a motion that we watch this bill.
I second it. BRN moderator, can we open it up for public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Are there any public requests for comments in HQ2?
There are no further requests for comments here.
Thank you. Are there any public requests for comments in San Diego?
Nope.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. All right, we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan.
Mary Fagan, yes.
Elizabeth Woods.
Woods, yes.
Jovita Dominguez.
Jovita, yes.
And Patricia Nguyen.
Win, yes.
All right, the motion carries. Moving on to SB 1334, meal and rest periods, hospital employees. Lori?
Yeah, so today's law, I'm just going to read off the first section for y'all real quick. And it says meal and rest periods are essential worker protections that reduce accidents, improve productivity, and promote employee well-being. In the healthcare sector, fatigue may adversely impact patient care, and meal and rest periods are important to ensure quality care. Private sector hospital employees who provide direct patient care in acute care hospitals are guaranteed meal and rest periods and a remedy of 1 hour premium pay for missed meal and rest breaks, while such employees in the public sector lack these basic protections, even though they perform the same duty. Worker health and safety and high quality patient care are matters of statewide concern and are the basis of numerous laws and regulations. This act ensures quality and working conditions and patient care standards for hospital, clinic, or public health employees who provide direct patient care or support direct patient care. So it talks about meal breaks being entitled to 30 minutes on shifts over 5 hours, and a second 30-minute period on shifts over 10. It goes through just the various provisions on this. And so it is aligning the requirements as it states from private sector to the public sector.
Any questions or comments from the board? I'm inclined to support this.
Yeah, I don't know why we wouldn't want to support this.
Yeah.
Yeah.
Patricia Nguyen?
I just have a quick question. Does this align pretty much with what hospital settings do for nurses?
So this is private right now in private hospital settings, yes.
Okay.
As Lori stated, this also now includes the public sector, Lori?
Yes.
Yeah, this is exactly what we do in my hospital.
Thank you very much. That's helpful.
All right, so I would like to, is there any more other comments or questions? Any from San Diego?
The piece about the bill would exempt employees who are covered by a valid collective bargaining agreement that provides for meal and rest periods. Do we know, would that apply to public and private or only public?
Reza, do you
I'm
have
looking up
information
to
on
see if I
that?
see anything on that.
Yeah, I'm also taking a look here.
And I think, to me, that would be important if it was going to exempt collective bargaining agreements or employees who are represented, that it would make sense to do it for both.
Says this bill will entitle employees who provide direct patient care or support direct patient care in a general acute care hospital, clinic, or public health setting directly employed by specified public sector employees, specified public sector employees to one unpaid 30-minute meal break on shifts over 5 hours and a second unpaid 30-minute meal period on shifts over 10 hours as provided by specified existing law.
Yeah, and then they do define the employee and the employer and the general acute care. So they define employee as an employee who provides direct patient care or supports direct patient care in a general acute care hospital, clinic, or public health setting. The employer that they define that these affect mean state, political subdivisions of the state, municipalities, and the regions of the University of California. And then it defines the general acute care hospital, which means a health facility as defined in subdivision A of section 1250 of the Health and Safety Code. So I think that that's where we would go to get that information, where it talks on D, the one that you referred to, Mary, that says the section does not apply to an employee. And that would be the person who provides direct patient care and supports direct patient care in a general acute care hospital, clinic, or public health setting. Directly employed by an employer. And so that's when you would go down and say that means the state, political subdivision of the state, municipalities, and the regions of University of California, who is covered by a valid collective bargaining agreement that provides for meal and rest periods. And if the employee does not receive a meal or rest period as required by the agreement, includes a monetary remedy that at the minimum is equivalent to 1 hour of pay for each meal period violation and 1 hour of pay for each rest period violation at the employee's regular rate of compensation for each workday that the meal or rest period is not provided. So your question was whether this was private or public. And so when you would look at the definition of employer, you would read out that the employer is the political subdivision of the state, municipalities, and the regions of the University of California. Does that help to see whether or not?
It doesn't seem like that clause would apply to private sector to me.
It does not seem.
Yeah.
Yep.
Any further questions or comments from the board? All right, I believe we have a first and a second on the floor. Can we open it up for public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comment. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and will move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Saskia Kim would like to make a comment. 1 second, please. Go ahead.
Good morning. Can you hear me okay?
Yes, ma'am. Good morning.
Great, thank you. Saskia Kim with the California Nurses Association. Thank you for the time today and apologies for yesterday's technical glitches. CNA is sponsoring SB 1334 by Senator Bradford and respectfully, as Lori mentioned, currently in California, only private sector nurses are guaranteed enforceable meal and rest periods, while nurses employed in the private sector lack these basic protections, even though they perform the same duties. So hospital employees at UC and other public sector healthcare facilities deserve the same meal and rest period enforceability that healthcare employees in the private sector currently enjoy. Occupational fatigue is a known issue in the general U.S. workforce, and there's evidence that its prevalence among nurses is much higher. And we believe better rested nurses can provide higher quality patient care for Californians, so we request your support of SB 1334. And I just wanted to quickly mention, in terms of your question, Mary, Lori is right. This bill applies to public sector workers and the public sector hospital employees, and that language was included to essentially set a floor so that if there are collective bargaining agreements out there that already provide for what the bill is now providing for, those would be exempted. So that language was included to address, from a legal perspective, potential contract clause issues is why it's in there. I hope that helps provide some clarity on that point. Thank you again.
Thank you for your comment. Board President Trujillo, there are no other public requests for comment in the WebEx. Are there any public requests for comment there in HQ2?
There are no further requests for comment.
Are there any public requests for comments in San Diego?
Not in San Diego.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, thank you. All right, we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan?
Mary Fagan, yes.
Elizabeth Woods?
Woods, yes.
Jovita Dominguez?
Jovita, yes.
And Patricia Nguyen.
Nguyen, yes.
All right, motion carries. We are next on SB 1475, Glazer bill on blood banks and collection. Lori?
Thank you. So this bill has been brought in front of the board. The previous position was opposed. It continues to authorize blood collection at a blood bank when a physician or surgeon is not physically present, if the medical director and their medical advisory committee approve, and if the employee placed in charge is an RN. The bill does authorize the RN that is in charge to either be physically present or available via telehealth, so long as the method of telehealth used is synchronous. So I think that I'm not seeing any huge changes from when it was presented to us and the board took the position of opposed. It still allows for an RN to not be physically present and to perform via telehealth, which were the concerns that the board raised. It does say that the telehealth now is synchronous, but it still, I don't believe that that addresses the board's concern when they were talking about responding to any medical emergencies or medical incidents that would occur, whether it be synchronous or that's still off site and not on site. So that is the changes and stuff to be discussed.
Thank you, Lori. Any questions or comments? Patricia?
My comments are the same as they were the last time we discussed this bill. I think it's safer to have an RN on site at a blood bank, especially if it's a busy blood bank. Things happen. So I would like to continue our opposed position on this bill.
Thank you, Patricia.
I would like to continue that also. These blood banks can have a dozen people in them at one time, and being available by telehealth is not acceptable.
This is Jovita. I strongly agree.
Any other questions or comments?
No, my comment is the same as it was before. I think this, the goal should be to have an RN, but the amount of time that blood drives get canceled because an RN is just not available, even though they're attempting to get one there, really inhibits our ability to have blood available for people. So I don't know what the answer is, but I know it's a double-edged sword. So.
It is, but if I were a blood donor, I would also be concerned that there was not an RN present in case I or somebody else had a reaction. And as a former, I used to do plasma donors, and we had reactions all the time. Any other questions or comments from the board? All right. BRN moderator, can we open it up for public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment.
Mark, before we do that, I need to make the motion.
Oh, sorry. Go ahead.
Initially, it sounded like we all voted, but I need to make the motion. So I would like to make the motion to continue to oppose this bill.
Win seconds.
Thank you. Now we can open it up for public comment. Thank you.
I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Saskia Kim would like to make a comment. 1 second, please. Go ahead.
Thank you. Saskia Kim again with the California Nurses Association. Just restating our our opposition to SB 1475. You've heard me testify on this bill before, and the most recent amendments unfortunately don't change our position. We still remain opposed to this bill because we believe the presence of an RN is necessary to assess and address complications when a blood donor suffers an adverse health event. And data show that California has a greater incidence of complications than other states, demonstrating the need for the presence of an RN. So thank you for your continued opposition to this bill.
Thank you for your comment. Board President Trujillo, there are no public requests for comments on the WebEx. Are there any public requests for comments in HQ2?
There are no further requests for comment.
Thank you. Are there any public requests for comments in San Diego?
No.
Thank you. There are no public requests for comments. Would you like me to close this window?
Yes, please. Thank you. All right, we'll take it to a vote. Dolores Trujillo votes yes. Vice President Mary Fagan?
Mary Fagan, no.
Elizabeth Woods?
Woods, yes.
Jovita Dominguez?
Jovita, yes.
And Patricia Nguyen.
Nguyen, yes.
Motion carries. All right, this concludes our open session. To complete the agenda, the board will now go into closed session for disciplinary matters and pending litigation. At that
Thank you,
point,
Dolores. Just a reminder to the people in the open locations as well as on the WebEx that we will be ending the WebEx, and the board members will only come back on to adjourn.
Reza?
This is Reza. So, Lori, did you want me to go over the bills, the positions on those? We voted on them and adopted.
Please, yes.
Yes, we could do
Thank
that.
you.
Okay. So the votes already took place, but this is, I guess, for sake of a recap. And if anyone else had something different than what I read, please let me know. So AB 852, the motion was to support. AB 1662, to oppose. AB 1711, watch. AB 2626, support. AB 2684, support if amended. AB 2055, support. AB 2107, to watch. AB 2790, oppose. SB 962, watch. SB 1334, watch. SB 1475, oppose.
SB 1334 was support.
Okay, I'm sorry.
I'm glad you read it.
Glad we did that, yeah.
And then SB 1475 was opposed, to continue to oppose.
Yes, sorry for the
Okay.
mistake on 1334. Okay, and then as far as entering the closed session, and then once that's concluded, typically we would come back into open session just for the sake of adjourning the meeting. Is that okay? So that's what we'll do. We're going to enter into closed session, and then the board members will come back to this hearing room and to the WebEx after that's over for the sole reason of adjourning. There will be no further actual board business once we return to open session.
Reza, a technical question for San Diego. Do we need to keep the public location open during the closed session, or are we able to close out this location?
Well, I don't think you have to keep it open. You're in that location, and members of the public can't be in the closed session.
Correct.
At the end, when we go back into open session, that's when that location technically should be back open again. But again,
Okay.
there's not going to be any board business handled in open session once we return.
Correct.
Is that going to be feasible for San Diego? I know we've got a hard stop at 1:15, but it sounds like we'll probably be done by then.
That should be fine.
Okay. Okay, so I think that'll conclude the open session
We'll be
for
back
now.
to adjourn the meeting after closed session.
Thank you.
Good afternoon, everyone. We are back together to close this meeting for the second day of the BRN board meeting. We will establish roll call. We will establish a quorum by doing roll call. My name's Dolores Trujillo.
Elizabeth Woods, Jovita Dominguez, Tricia Nguyen.
And
Mary Fagan.
thanks, Mary. We have established a quorum. We will now adjourn. Thank you. Have a wonderful week.
Thank you, guys.
You too. Good job, guys.
Bye-bye.